Hi everyone, my name is Maribel, and this week we're going to be talking about a nursing degree or nursing major. So we've talked about psychology major, we've talked about business administration major, and I kind of want to get into another field, which is like the medical field area, and one of the most common and looked for also occupation, which is nursing. So I'll be talking about why it's important, why you might be interested in it, the education needed, what courses you need to take to prepare for this, a job description, general of all nurses, some careers and jobs available, and schedules and salaries, with possibly some tips, and then end where you can actually also attend and finish schooling in your education here. Okay, so why nursing? I don't know if you watch, Grey's Anatomy, if you're a fan of the show, but that's where I became more interested in understanding more of the, nursing world and just in medical field. But it is an endless job. This career has endless job opportunities. It's a pretty diverse field that you can get into. Jobs never becomes boring or stale and not repetitive, and you can change if you don't like a certain setting, a certain education, a certain field. You can change it and change it around. You can actually kind of serve around in different fields, like I was mentioning. So if you like to help people, you have good people skills, you have a passion and care for people to get better and get well, you're a comforting person, then this could be like a career for you. To keep in mind, a lot of psychology majors might end up being nursing majors, or vice versa. Actually, a lot of nursing majors end up going into psychology. So that's why, because you're helping people just in a different capacity, in a different way, more on the medical side instead of the psychological side, but it's very similar. So why this field too? It has the highest growth rate for occupation. It's like 15%. So like it's gonna be a huge need. You're always needing nurses because people are living longer, so people need to be taken care of. So nurses are definitely, the nursing field is definitely an occupation. It's going to be needed, and then salaries are going to continue to climb. And another reason why you want to look into this is like California is the number one highest paying, that pay their nurses the most, and we live in California. Okay, so what education do you need? So keep in mind, and I would mention and highly encourage it, if especially if you're living in this county or Merced County, that you want to look into going to a junior college and doing your prereqs, because you need to do a couple years of prereqs to be able to actually get into the program, the nursing program. And I'll be specifically talking about maybe here Merced College. So you go to Merced College, you could go to Modesto Junior College, get your prereqs done. And these are not just any prereqs, these are intense prereqs, and I'll talk about what some courses are there too. It is, before getting into a program, you need to have really good grades, so you need to learn how to study, because it's a very competitive program, very impacted program. People apply for it and not always get in the first time, sometimes second, third time. If you've heard of the lottery system, that is something to look into, because sometimes not just having the highest grades is going to do it. They look at your grades, they look at your experience, they look at also even your gender and stuff, because they like to have a diverse, you work with different populations, so they look at there's a count, and I don't know specifically, but you'll need to score high on certain points to be able to get into the program. But it's really important that you have really good grades. Sometimes you have to have like almost a 4.0 to be able to classified on the top there. So it's having really good grades gives you a higher chance to get into the program, but that's not the only thing they look at. Remember, experience, being maybe working as a CNA is going to be a pro and a tip that I will mention later too. So definitely learn how to study. It's going to be important. And I don't know if you have seen my videos, there's just how to study, how to memorize things faster, how to take notes, because you're going to be learning a lot. It's going to be information overload. So especially in certain classes, and I know people that they said studying is very important and you have to get really good grades. And in the program, you can't get anything lower than a C because you will have to, like, it's like failing. So keep that in mind, okay? So some of the courses that you will need to take is like human biology. That's like your general one. It's a prereq of the prereq. Human biology is like you're examining genetics, evolution, and how the body functions. And this is just an overall view, like understanding of how the body is. And then another biology class you take is anatomy, which is like another biology, right? So this is a part of biology that specifically examines the bodily structure of humans and any other living organism, and particularly dissecting parts. And then if you want to get even more into like that, we're looking at the next class, physiology, or is a course, is part of biology that studies and deals with the normal functions of living organisms and their parts and how they function. So I feel like it's even more, you're getting you more into it. So you go from looking at examining the whole body, then you're looking at parts, then you're really looking inside the organisms, like that's physiology. Then you're looking at chemistry classes, and these are not my favorite. That's why it probably didn't work out for me. It's a study of anything that takes space, and how it changes when it undergoes different environments and conditions. And I understand it now, but I didn't understand it back in the days when I was taking it. Chemistry was just not my cup of tea, or any kind of sciences other than biology. The general biology, not the human biology. Psychologies you're gonna be taking some psychology classes, and remember, this is the study of how people behave, how they think, how they feel. You're looking at memory and reasoning and language, personality, and any mental health part. You have to understand that when you're working with people. Okay, then you're looking at sociology classes, because you be working with people, groups of people, right? So study of how people behave, how they think and feel. The study of development, structure, and functioning of human society and social, and understanding social problems. So you really understand in the groups of people. And then you have nutrition class, because you have to understand like health and the lifestyle choices to be able to live happy, healthy, and perform your best. That's definitely important. Nutrition is part of that. And after you take all these classes, and you probably do some clinicals and go into the field a little bit to understand more. Actually, you're not doing that. That's just a prereq. Never mind. You will need to take a test, which is important. It's called the NCLEX, National Council Licensure Examination. So once you're done with the program, once you get into the program, there's also another test you need to take. That's just a general understanding. I forgot. There's a T-test that we take here at Merced College, to be able to, and you have to score. It's just general understanding of, certain subjects. Kind of like a little bit of GED, general stuff. But once you have that, and you pass, you get your associate's degree, and you did the nursing program, you do have to pass this board exam. So it's a board exam that it says a candidate's ability to provide safe and effective nursing care upon entry and be able to practice in the U.S. So once you have, you get your prereqs done, it's 2 years usually, then you can get into the program, the nursing program, and you have another 2 years of it. Then you have to prepare for this NCLEX, the National Council Licensure Examination, to get licensed. Then you can actually go out there and become a registered nurse. And this is just with an associate's. So the education really needed in this field to be able to register nurse, you're looking at just maybe getting associates and passing this board exam. And you can actually start getting paid pretty good money. And I'll explain how salaries work. So you can be working in hospitals, you can be working in schools, inside the homes, in a cruise ship, at airports, at clinics, in the mental health, in prisons and jails, and at a dentist's office. You could be doing maternity, intensive care, oncology. You could be in surgery, in psychiatric, pediatric, and emergency. You pretty much can work and specialize in different areas. So different fields, different areas. Okay, so your job description consists of, planning the care and teaching the individuals how to stay healthy or cope with their illness. You can be giving them medicine, treatments, any tests, or injections. You'll be drawing blood. You'll be observing, patients for physical, mental, social, and emotional changes. You'll be recording any changes, reactions to illness or the drugs. You'll be taking temperatures, the pulse, their blood pressure, or any vital signs. And then your job will be maintaining health records. So when someone explained this, you really are the middle person, the mediator. So you really need to have, again, those people skills. You really have to have strong skin, because you're going to have people who are mean, when they're going through a hard time, they might their bad side comes out, their ugly side, and you have to be understanding, very empathetic if you're going to be working as a nurse, which, that's why, there's mental health clinicians. They understand that sometimes, stress can lead to being someone that you might not want to be. And there's a lot of stressors. So it can be a stressful job. But if you have people skills and you care for people and you like helping people, I know there's some people that when they get sick, they need someone to be taken care of. And that's pretty much what a nurse is. You're going to be taking care of someone. And sometimes if they don't have family, you're that one person. So the nurse can really make a huge difference in someone's life. And I think that's something to consider. And I'm like, oh, I can appreciate nurses so much more as long as you go in for the right reasons. Some people think that nurses get paid good money, which in reality they do, but they do a lot, and they can be doing a lot. So positions could consist of a clinical case manager. So there's case managers that are in charge of maybe a discharge of clients that are discharged. So what services they might need. So they call them clinical case managers or social case managers, which also is something that I remember doing as a case manager in the mental health. Coordinating services, assessing what the client is needing, and then, making sure they're getting their services and get the right referrals, right? Then you have a school nurse, which I believe is probably the best job, because I like working in the education field, and you only have to work from 8 to 4. It ends, or 8 to 5, depending, maybe 7 to 5 or whatever. A good 7 to 3, depending on the hours of schooling, and you're done. You got weekends off, and I feel like you get summers off too, and you get paid good money. I mean, that's like the best job, I think. There's another one too that's similar to that. Then you have correctional nurses, people that work in prison, because also obviously people in jail need nurses. Risk management nurses are those who assess any risk of their falling. They have to make sure that, wherever they are working, if they're working in hospitals, that there's less risk of people falling, because that can cost the hospital, the company, a lot. You can work in homes, taking care of people. You can be an administrator. You can be a clinic nurse, working in clinics, of course. You can be an instructor. Of course, this is going to require certain positions will require higher education. Like if you're going to be teaching, if you want to be an administrator, you're looking at least getting your master's, sometimes even doctorate if you're teaching, but master's for sure. There is clinical, oh, you can also be an HR recruiter because you know more about nurses and what to look for in nurses. You can be a travel nurse. I was like, awesome. If you like to travel, you can be a travel nurse. It's needed. There's nursing informatics, which are they do the research. They are nursing practitioners, and which are where those are looking at master's degrees. So schedules can vary, you guys, but it's really common for nurses to work 3 days, 12-hour shifts, so 36 hours. Some people have side gigs, which is highly encouraged if you want to increase, your salary. Because if you're you can work 3 days a week and then be working somewhere else for 1 day, and you can still have 3 days off. I think I like that. I would love to have 12-hour shifts because I can work 3 days and have 4 days off. But I'm sure it's tough. It's not easy. So there's inpatient and outpatient care. And if you're inpatient, you're looking at 8 to 5 hour schedule, Monday to Friday. And that's also kind of like working in the schools, the 7 to 3, 8 to 5, depending on your school. You get summers off. If you're outpatient or inpatient, oh, I think I messed up there. Inpatient, sorry, inpatient is hospitals. Outpatients is, when you're actually the 8 to 5. The inpatients when you're in the hospitals. If I have that wrong, oh gosh. Anyways, and so you're looking at, if you're working in the hospitals, you're looking at 12-hour shifts, and you're not going to have holiday. You probably have to work on holidays, but you get extra pay. And then you're probably working on weekends, and sometimes you start at night shifts. So it can be hectic. Your schedule can be hectic, but you can be, depending on where you want to work. I think like if you decide to work at clinics, outpatient clinics, you can have the 8 to 5 schedule, Monday to Friday. Of course, the more critical places like hospitals pay more than if you were in clinics, but you still could pay good money. It's no different. I feel like there's a little small difference, but if your schedule is a big deal, you can actually, travel nurses have different schedules. If you're doing home care, you can decide on your own schedule. So the schedule can vary, but it's most common to do the work for 3 days and do 12-hour shifts. Okay, so salaries, you guys. So your salary is dependent on location, because the highest paying states, I believe, is California, and there's Hawaii, and I forgot what was the other one. But I'm focusing more in California. So average annual in the country the average annual income or salary is $73,000, and that's about $35 the hour for registered nurses. California, here, it's $102,000 and $50 the hour. This is just average, you guys. I'm like, wow, this is awesome. I get it. It's not an easy job, so I gotta say, definitely earned that. And here in the Stanislaus County, you're looking about $7,000 to $10,000 a month. Well, not here. I meant to say Stanislaus and Merced, you're looking at about $7,000 to $10,000 a month. You're looking at about $90 to $130 if you're in the higher. Remember, it really depends on years of experience and your degrees that you receive. Any specialties, because certain specialties like critical care pays more. Okay, so you're looking at about $45 the hour. This is just average. I know people that get paid 50, if not 60, dollars the hour. So it's crazy, and it's awesome. Definitely well earned though. And tips to say to pick up overtime. It's easy. After your 3-day 12-hour shifts, you do 4 hours, and that's considered still regular pay, but after that is considered overtime. Start with the CNA. Make sure you do the CNA first to get that experience and get higher points when you apply for the program. Get into critical care, which pays more. Definitely get higher education, because the higher education you have, the more opportunity you have to get paid even more. I think up to like $150,000, $160,000, I believe. That's like your teaching jobs, your midwife practitioner, is that what it is? Or midlife delivery person, they get paid up there in the 160. So I really feel there's a lot different than being a doctor. Doctors do look more into like surgery. They're like into the inside of the body a lot more, and so they are totally different. Their focus is totally different. So don't ever ask someone why didn't you become a doctor instead and go higher. No, it's just different focus. So if you decided you wanted to focus on this, you're looking at going. You can go to Merced College, do your prereqs, or Modesto Junior College or Fresno City College that are nearby, and get your prereqs done, and then you can apply for the program. Make sure you're also be doing the maybe the CNA, which is usually a semester long. The CNA program, that is going to give you experience, going to give you hours, and you can get more points to get into the program. Of course, there's online programs that are faster, but they are more expensive. So I don't highly encourage it. You can also go to CSU Fresno, CSU Stanislaus, and CSU Long Beach if you decide to further on your education and get your bachelor's and even your master's. And then they highly recommend UCLA and UC Davis. They have a really good program to becoming a nurse. Okay, you guys, I think that's all I got for you this week. I hope I learned a lot, and I really learned to appreciate more this, occupation, this major, if you decide to make it a major. Again, 4 to 5 years of getting ready to get paid pretty good money. Remember, the average was $70,000, about $35. And then the more education, the more experience you have, the higher you'll get paid. So I thought that's a good deal, and you're taking care of people. If you already take care of your husband, who maybe is such a baby, just kidding. It's something to look into. If you have the nurturing heart and helping others and caring for others, and you're compassionate and you're patient, this could be the right field for you. Okay, well, that's all I got. Hope I see you next week. I'm not sure if I'm going to continue talking about majors. If you guys have any special requests, let me know. Maybe I can focus on a field that you might be interested. I'll take some special requests. But until next time, see you next week. Bye.